prepared for y'all. All right, so again, Tiffany, thank you for the introduction. I'm Erin Steigleder, and I'm going to chat with you a little bit about breast cancer today. I'm going to start with information about our organization, just a little bit, and then I'll get into the meat of the presentation, which is education aspect. And then we'll talk a little bit about access and advocacy. So the mission of Virginia Breast Cancer Foundation is we empower Virginians impacted by breast cancer through access, advocacy, education, and community action. We were founded in 1991 by a group of 5 women who met at a breast cancer support group at VCU. They were frustrated that they were receiving the same treatments for breast cancer that their mothers had received decades before. So they got some people together and hosted a Mother's Day rally at the Virginia State Capitol. And then they gathered with organizations that were developing across the country and hosted a rally in Washington, D.C. We keep that spirit of advocacy as well as educating Virginians about breast cancer to this day. And here are some pictures of some volunteers and board members traveling all over the state of Virginia to give presentations, sit at health fairs, and basically make sure that folks have access to information about breast cancer. So I like to have some pop quiz questions. Any thoughts on this one? Any guesses on how many milk ducts do women have in each breast on average? Anyone brave enough? So the answer is between 5 and 8 ducts in the average breast. Why do you need to know this? Honestly, this number is not really important for you to remember, but I bring this up for 3 reasons. One, when I learned this information, it was something new about my body that I did not know before. And when it comes to our health, knowing how our body normally works helps to keep us healthy. The second reason I bring it up is that most breast cancer typically starts in the ducts. The third reason is that researchers, doctors, they didn't know the answer to this question either until the 1990s because they hadn't looked. We are behind when it comes to understanding the normal operation of the organ of the breast. I'm sure I don't have to tell y'all that, but not only with breast cancer, but how it works with breastfeeding, why some people can feed their babies with breast milk only, why some people are overproducers, all these things. We don't really understand the process of this organ. So backing up, what is breast cancer? Cancer, in a very general way, is when our own cells start to grow and mutate abnormally. Breast cancer is when this process starts in the breast. Typically, cancers are named after the organ system where they began. Breast cancer can, like some other cancers, can spread to other organ systems, but it is still called breast cancer even after the spread because the breast is where it originated. These purple tubes right here are the milk ducts. These purple lumpy globs are the lobules or the milk glands. And then up at the top are lymph nodes. We have lymph nodes all over our body, but we have a bunch of them scattered around our chest as well. I tell people that breast tissue isn't just in the obvious place. It goes up to the collarbone and down to under the arms. So if there's any change in this whole area, I tell people think about where a sports bra touches. Then they need to mention that to a doctor. There are different types of breast cancers as well. It's not just one disease. Breast cancer is very individual of a disease, but there are some broad categories that I'll talk to you about. Most breast cancer is hormone receptor positive. That means that it is essentially fed by estrogen and progesterone, which are present at pretty high levels in a woman's body. There's also a protein called HER2 that can make breast cancer more aggressive. The good thing is that with both these hormones and with HER2, we have specialized medicine that can target these hormones and the receptors in the tumors and essentially starve the tumor of these chemicals. So it makes it easier for the tumor to disappear and makes it less likely for the breast cancer to come back. There's also triple negative breast cancer, which doesn't have the receptors for estrogen, progesterone, or HER2. That's why it's called triple negative. You would think that would be a good thing, But unfortunately, that means that we haven't yet found what we can target in this type of breast cancer to shut it down. Triple negative breast cancer is a more aggressive type of breast cancer. It is also more commonly found in younger women and in young Black women. Some statistics for you. We're unfortunately expecting over 300,000 new invasive cases of breast cancer this year in the United States. What I mean by invasive breast cancer is that it has grown beyond the duct where it began. You might have heard of a breast cancer called DCIS, or ductal carcinoma in situ. This is technically stage 0 breast cancer, which means it's breast cancer at the earliest that we can catch it. And that does not count as an invasive type of breast cancer. So that's not included in this 300,000 number. We're also anticipating over 42,000 deaths from breast cancer nationwide. In Virginia, we're looking at over 8,000 cases diagnosed and close to 1,200 deaths. I'll touch on this a little bit. Men get breast cancer too. It's much less common, but it does happen. If you have 100 people with breast cancer in a room, one of them will be a man. Men they don't get mammograms, and sometimes it can be difficult to get men to the doctor. All right, next pop quiz question. Getting a mammogram every year can reduce a woman's chance of getting breast cancer. True or false? Anyone?
False.
So it is false. It's a bit of a tricky one because we talk about mammograms as preventive care, but really mammograms are a camera. They take a picture of what's already happening. There are some instances where you can remove some questionable cysts or something like that after a mammogram, but the mammogram itself is not going to reduce your risk of developing breast cancer. So it's different from, say, a colonoscopy, where it's in the same procedure that you can remove precancerous polyps. So I've had people come up to me at health fairs saying, I don't need to know anything about breast cancer because I get my mammogram every year. A mammogram does not prevent you from developing breast cancer. So what can we do to detect breast cancer? How is it usually detected? Usually it's found by the person themselves or their partner. I've heard a lot of stories of people who are doing everyday activities. They're doing household chores, they're reading a book, they're getting dressed and moving their arms across their chest, and they find something different. So that is something that people will report to their doctor. There's also the clinical breast exam, which is when folks go to their gynecologist for the annual well woman visit, and their doctor checks their chest for any changes in skin or any lumps or bumps. Mammography is still the gold standard when it comes to screening for breast cancer. So, as I mentioned earlier, mammogram is an X-ray of the breast. It is recommended that women start getting screenings for breast cancer starting at the age of 40 if they are of average risk of developing breast cancer. I'll talk about this a little bit more later, but good clues that you are of average risk is if you do not have a lot of breast cancer in your family, and if you don't have anything in your personal health history, it makes you at higher risk of developing breast cancer, like being a childhood cancer survivor. If you are at higher risk, that changes the equation as to when folks should start getting mammograms. A common example that I give is that if your mother was diagnosed with breast cancer at age 45, you should start getting mammograms at age 35, 10 years younger than your first degree relative was diagnosed. There's also breast ultrasound and breast MRI. These are also used to detect breast cancer, typically after the use of a mammogram. I have some people come up to me and say, I get the ultrasound every time anyway, why can't we just start there? And it's because a mammogram delivers an accurate overall picture that someone can then follow up with an ultrasound to get a closer look at certain areas. If we just start with an ultrasound, we're likely to miss something small. Breast MRIs take much clearer pictures of the interior of the breast, but they're also very expensive, and they use contrast, which it adds to the risk of the procedure. So this is why mammography is still the best tool that we have for the general population to detect breast cancer. What am I looking for? The most common symptom that we talk about and we hear talked about is a lump. But that's not the only symptom that can show up and can indicate breast cancer. The short answer is any change to the breast is something to mention to a doctor. With pregnant and postpartum and nursing moms, that's going to get a whole bunch of new wrinkles. But generally, if there's an unexpected change to your chest that sticks around for a while, it's something to mention to a doctor. So changes to the nipples, an unexpected discharge, changes to the skin texture, an appearance of a rash that won't go away. These kinds of things should be mentioned to a doctor. Another quiz question. You don't have to worry about breast cancer if there isn't any on your mom's side. True or false? False. Two reasons. One, father's family history matters just as much as mother's. People can forget about that because they think, oh, dad doesn't have the parts. So they aren't thinking about dad still contributes 50% of your genes. So something might be going on in his family, even if he himself doesn't have breast cancer. And also, the vast majority of people diagnosed with breast cancer do not have a family history or genetic risk for developing breast cancer. That was the situation in my family. My mom was diagnosed at 61. The second youngest of her many sisters, and there had been no cancers in her family at all. It's just one of those things. She also used to say that family history starts somewhere. So risk factors for breast cancer. Number one risk factor, being born biologically female. We have higher levels of estrogen and progesterone that feed the most common types of breast cancer. That's just another gift we have of being born biologically female. Another risk factor is genes. You probably have heard about BRCA or BRCA1 and 2. These genes, the mutations on these genes are the most common type of genetic mutation that increases breast cancer the highest amount, but there are also other ones that don't really get as much attention. So if you've gotten a BRCA test and it comes up negative, but you have a lot of breast cancer in your family, there might be some other genes that you should test. We really recommend that people talk to a genetic counselor when it comes to getting genetic testing for breast cancer. Because when you speak to a genetic counselor, you can talk to them about your family's health history, but also your ethnic background. And then with those pieces of information, the genetic counselor can recommend which specific mutations on which genes you should be tested for. It's much more efficient testing system for you. And when you get results back, they can explain them to you. A lot of times we'll get some results back that say something is different about your gene, but we don't know if that's necessarily a bad thing. So the genetic counselors can explain all that to you. There are also some menstrual factors that can increase risk of breast cancer. If you've had your first menstrual period before the age of 12 or enter menopause after age 55, it means that you've been exposed to estrogen for longer, and that can increase risk of breast cancer. Alcohol use can also raise the levels of estrogen in our bodies. They think there's some studies now that they think particularly the alcohol use before first pregnancy has the most impact on our breast cancer risk. Unfortunately, for many women, that means college can increase, drink behaviors in college might increase risk of breast cancer later on down the line. And the reason why pregnancy is important for this is because the thought process is that the breast cells do not mature fully until they've gone through a full-term pregnancy, because then they've gone through all the changes of maturation. And these mature breast cells are less likely to develop breast cancer. But if they were impacted by something before they fully matured, then they might be more likely to develop cancerous cells in the future. This is still pretty early research. We can't quite pinpoint everything, but it's one of the theories that's being talked about. Body fat can also increase risk of breast cancer, particularly after menopause. After our ovaries stop putting out so much estrogen, our fat cells are actually the highest source of estrogen that we have in our bodies. Age is a risk factor. Generally, breast cancer is more common as we get older, but what we're seeing now is more younger women are being diagnosed with breast cancer. And when I say younger women, I mean women under 50 and under 40 even. I think recent statistics are that the number of women under 40 getting diagnosed with breast cancer is going up by 1% every year. And we don't quite know why. So particularly for women who are in their family planning stages of their lives, they're more likely to hear from a doctor, oh, you're too young for breast cancer. Don't worry about it. It's probably just a cyst. What we try to encourage people to do is don't take that as an answer, but to talk to their doctor, explain why they're concerned and that they want to get it checked out. And if their doctor refuses, then it's okay to find a different doctor until you get the answer that you need. Dense breasts are also a risk for developing breast cancer. Generally, when we are younger, our breast tissue is more dense and fibrous. And as we get older, after pregnancies and breastfeeding, the breasts become more fatty tissue. We're seeing more women retain that dense breast tissue as they age. This image on the left is almost entirely fatty breast, and the image on the right is of a very dense breast. One of the main issues with dense breasts is that dense tissue shows up as white on mammograms, but so does potentially cancerous tissue. So it can be like finding a needle in a haystack if we're looking for cancers in a very dense breast. There's also some conversation around having dense breasts in general increases your risk of developing breast cancer. So the recommendation here is to get a 3D mammogram or tomosynthesis if you do have dense breasts. And Virginia residents, it's been the law for many years now. It's FDA made it a policy nationwide that after you get a mammogram, in your all clear letter, you should receive information about whether or not you have dense breasts and what that means. Anyone can be affected by breast cancer, but breast cancer doesn't affect everybody equally. I mentioned that triple negative breast cancer, the more aggressive type of breast cancer, is more common in younger women and Black women. Triple negative accounts for about 15% or so of breast cancer diagnoses, but can account for 40% of deaths. Black women are 40 to 42% more likely to die from breast cancer. They're also generally diagnosed younger than white women are diagnosed. And still, we're hearing a lot of stories from Black women who say they went to the doctor told them they were too young, so they waited, and their breast cancer was diagnosed much later than it should have been. I'm going to speak specifically on pregnancy and postpartum for a little bit. Recommendation is if you are newly postpartum and you are of regular breast cancer mammogram screening age, or if you are getting screened early because of high risk, the general recommendation is that they like to wait between 2 and 6 months after you finish breastfeeding before they do a mammogram. And that's just because of all the changes that the breast goes through when it is lactating. And it can become more dense and more difficult to read images. If someone is experiencing a symptom of breast cancer, however, they can still get a mammogram during lactation. It doesn't hurt the milk, won't hurt the baby, but it's just more difficult to get a good image in a woman who's lactating. Ultrasounds can also be done of the breast while someone is pregnant nursing. I will say that the mammogram during pregnancy is going to be less likely due to the X-ray exposure. Pregnancy and breastfeeding obviously do cause changes to the breast. That is normal. And even common conditions like mastitis can look like potential breast cancer and vice versa. So a young woman who is breastfeeding and shows up at her doctor with a rash on her breast will likely be told, that's mastitis, we'll take care of it. And then it might end up being a type of breast cancer. So our recommendations for younger women who are in the pregnancy, postpartum periods of their lives to pay attention to changes to their breasts, new lumps, new shapes, rashes that develop, anything that feels odd, and talk to their doctor about it. If their doctor says it's fine and they feel comfortable with the answer that the doctor provides, that's fine. They don't need to pursue any further. But if they feel uncomfortable and feel like they're being brushed off by their provider and that the symptom is being written off is just because they're breastfeeding or they might have an infection, I would encourage this woman to keep talking to different doctors until they feel comfortable with the information they've been provided. Because we are seeing women being diagnosed younger. And we also know that if you're diagnosed with breast cancer within the first 5 years after giving birth, the breast cancer is more likely to metastasize or spread, likely due to the changes in the breast as a result of pregnancy. So with the breast changes during pregnancy, we do not need to panic about breast changes we experience during this time, but they should be noted and our concerns should be validated and addressed because breast cancer can happen in this period in our lives as well. Switching to some things that I know I've heard, I'm sure some of y'all have heard, are potential myths or products and life situations that can increase risk of breast cancer. These are a handful of the situations that have been examined many times, and they've found that there's no correlation between the use of the product or being in a living situation and risk of breast cancer. There are some things that you can do to reduce your risk. None of these are foolproof. I wish there's something that I could say that people can do and they won't get breast cancer. But breast cancer is a result of our behaviors, our environment, and our genes. And we never know which aspect is going to mean the most to which person's breast cancer diagnosis. So the 3 best things to do are, of course, the 3 most difficult: exercise regularly, get enough sleep, and maintain a healthy waist to hip ratio. BMI doesn't really help when it comes to the individual's assessment of their health, but it's more looking at the levels of belly fat. And again, it's not the number on the scale, it's more the belly fat that we pay attention to. Plenty of fruits, vegetables, foods with fiber can help keep our cells healthy, so they're less likely to go through that mutation process. Alcohol, I mentioned earlier, upper levels of recommendations for women are no more than 1 drink per day. It's better to have no more than 3 drinks per week. It is best for everyone to not drink alcohol. But if you do decide to drink, these are the guidelines that you should follow. We also talk about breastfeeding being a protective factor against breast cancer. The golden number that I've seen is 12 months. So that can be over multiple babies. So you can have 3 babies, breastfeed them each for 4 months, and there's your 12 months. The thought process is, again, that after the breast has gone through the process of maturation and lactation, it's less likely to have mutated cells. There's also a lot of research happening now in the breast microbiome, because our breasts have a microbiome just like our guts do. And there might be some interaction there with the lactation and the development of the microbiome. There are also some medications that people can take to reduce the risk of developing breast cancer if they are at higher risk. Some people are worried about getting genetic testing because they think the only thing they can do to lower their risk is to get surgery. And that's not the case. There's some medications people can take to shut down the estrogen in their bodies prematurely to lower their risk of breast cancer. I'll also touch on how important it is to participate in clinical trials. I know that's rather difficult for women who are pregnant and who are lactating, but if it's possible, clinical trials are amazing. That's how we have all these wonderful new treatments for breast cancer. When we were founded in 1991, it was the deadliest year for breast cancer in history. And mortality has gone down ever since because we've started paying more attention and developing more treatments for the disease. Last quiz question. If someone gets breast cancer, they did something to cause it. True or false? Was it hopefully an easy one? Absolutely false. As I mentioned earlier, there is some control that we have over some aspects of breast cancer development, but we never know. Because I'm sure we all know folks who have smoked for years and are fit as a fiddle, and people who never smoked a cigarette in their life and end up with lung cancer. So I tell the story too of a woman who won the gold medal in cross-country skiing, and then the next year was diagnosed with breast cancer. You know, she was in great shape and was taking care of herself, and yet she was still diagnosed. So the best thing we can do is to treat ourselves and our neighbors with compassion because no one did anything to bring this disease on themselves. A little bit about access. If you have health insurance, you can get a screening mammogram for free starting at age 40 and beyond. But if you don't have health insurance, there is a program in Virginia called Every Woman's Life that provides free breast and cervical cancer screening for folks who are uninsured. The screenings start at age 40, but if you're showing a symptom, you can get screened through this program. You can get a diagnostic test through this program early. And then if you do have health insurance and you get your free mammogram, and then you get a call back saying there was an abnormal result, you often have to go through a battery of diagnostic tests in order to actually get diagnosed with breast cancer or get the all clear. These tests have to be paid for. They're not covered with no out-of-pocket costs like the mammogram is, the screening mammogram. They require copays and coinsurance and can be up to thousands of dollars. So Virginia Breast Cancer Foundation established a program out in Southwest Virginia with multiple partners, and we just launched our program at a VCU to cover the costs of diagnostic testing for folks who are underinsured, can't afford the copays and coinsurance for diagnostic tests, and would otherwise forego the testing or wait. We don't want people to wait. We want people to go through the diagnostic process as quickly as possible so they can get their all clear, or they can go through and get started treatment as early as they can. Diagnostic funds are a Band-Aid. We're also working to solve the problem through policy change at the state level, and there's also a bill at the federal level to require health insurance companies to cover diagnostic services for breast cancer with no out-of-pocket cost. Us doing some advocacy work at the General Assembly, some policy wins that we've had over the years. And there's a lot more information available on our website, vbcf.org. We have blog posts, we have videos of interviews with experts, anything and everything you can think of, really. And if you see a pink ribbon license plate driving around, that actually helps to raise money for us. So if you're interested, you can go on the DMV website and switch up your license plate. And just some quotes that I hope kind of capture what I want you all to leave with today, that there are some things that we can control, but to let go of the things that we can't, and to think of what we can do to help others. And with that, that's all I have for you today. Thank you so much for your time, and I'm happy to answer any questions that anyone might have.
Thank you, Erin. Thank you for presenting today and for such rich information. Does anyone have any questions for Erin? I don't see any in the chat or the Q&A, so I'm going to give a few minutes in case anyone's shy. Going once, going twice. Okay. Well, take that to mean that your presentation was very informative. There's no questions right now. But just as a reminder, this is recorded and we will be posting it to our YouTube channel as well as all of our monthly webinars. So feel free to replay it there or to share it with others. And thank you again. If there's no questions, then we'll go ahead and end for today. Thank you for joining us today, and we look forward to seeing you again. Thursday is the next part of our perinatal mental health series. And then our next and last monthly webinar for the year will be November 19th. So thank you for joining us and have a good day, everybody. Erin, hang back just a second for me.
Thank you.